Specialty Stories, session number 51. Whether you're a pre-med or a medical student, you've answered the calling to become a physician. Soon you'll have to start deciding what type of medicine you'll want to practice. This podcast is here to tell you the stories of specialists from every field to give you the information you need to make sure you make the most informed decision possible when it comes to choosing your specialty. Welcome to Specialty Stories. My name is Dr. Ryan Gray, your host here every week, sharing stories of different physicians and their specialties so that you as a pre-med or a medical student or even a resident can figure out what it is that you want to do in the future. This week, I have an awesome guest. It was a great interview. It was actually somebody that was over to our house for Thanksgiving, and I roped him into coming down into my studio in the basement, and we recorded this podcast to talk all about neuro-ophthalmology and community-based neuro-ophthalmology at that. Dr. Bryan Pham is a community-based neuro-ophthalmologist who's only been out of training for a few months, so he's brand new to this. And he is sharing his story about his journey to become a neuro-ophthalmologist. So we start off, as always, by talking about what initially drew him to neuro-ophthalmology.
I was at actually a particularly difficult time in my neurology residency, and actually was a little bit disenfranchised from neurology. And the next rotation that I had coming up was actually neuro-ophthalmology. And that month really just rejuvenated my love for medicine and for neurology.
What about it rejuvenated you?
I like that there was a wide variety of disease. Actually, you could see all different areas of neurology represented within neuro-ophthalmology. There are strokes that affect vision. There are movement disorders of the eyes.
A little bit of everything.
Right.
What was it about neurology that had you disenfranchised?
So it was at the end of my first year of neurology, and then towards
a hard year.
towards the beginning of the second. But right, just having the very busy workload and without a real break.
Yeah. So I remember Allison, and if you're listening to this, Allison's my wife, who's also a neurologist. That first year of neurology is your second year of postgraduate training, right? So you do your internship.
Correct.
And then your junior in neurology, that first year of neurology, she was destroyed that year. And so it sounds like it's not an uncommon thing.
Right. I think across the board, the first year of neurology, the PGY2 year, tends to be the most difficult for everybody.
Yeah, that's crazy. All right. Well, so if you're going into neurology, expect that if you're listening to this. What traits do you think lead to being a good neuro-ophthalmologist?
I think somebody that really likes to take the time to think over their patients. It's a very cerebral field.
As is neurology
as a whole. Neurology, that's correct.
Yeah.
Not too much in terms of procedures, but I like the mystery of the patients and trying to figure that out. And so if that's something that you find interesting as well, it would be a great fit.
So it sounds like, and we had this discussion before we hit record, neuro-ophthalmology, you don't do a lot of surgery. You don't do any surgery because you're, and we'll go into this a little bit later, you're a neurology-trained neuro-ophthalmologist. So you're not a surgeon. You're not actually operating on any sort of pathologies or conditions.
Right.
Okay, interesting. So you're diagnostic neuro-ophthalmology. In the neuro-ophthalmology world, is there that division of a diagnostic neuro-ophthalmologist and a surgical neuro-ophthalmologist?
There are neuro-ophthalmologists that also do additional training in oculoplastics, and so they'll be a little bit more surgically minded.
As you were going through your training as a neurologist, what other subspecialties, if any, were kind of in the running for fellowship training?
Initially, it was actually neuro-intensive care, but then I realized I don't really like terribly sick patients.
Mm-hmm. Yeah, and the intensity of it.
Correct.
So talk about the types of patients that you're treating, that you're seeing. What sort of diseases, pathologies are you treating on a day-to-day basis?
So about 1/3 of the brain volume is dedicated to vision. And so as you can imagine, anything that affects the brain can and often does affect vision. We see essentially everything that can affect vision that doesn't come from the eye itself. So things like strokes affecting areas of the brain, causing vision loss, as well as different eye movement abnormalities.
Explain the difference. If I were a primary care, so there's somebody listening to this who's going to go into family practice, who's going to go into internal medicine or pediatrics, bread and butter primary care, why would somebody refer to neuro-ophtho over ophthalmology?
I guess I'll start with kind of our bread and butter diagnosis is a condition called idiopathic intracranial hypertension, or pseudotumor cerebri, where the pressure in the brain builds up, and that can lead to vision loss when it puts pressure on the optic nerves and causes them to swell. Nothing in the eye itself is abnormal. The problem is further on back. And so any conditions that where the eyeball itself is normal, but the vision is affected would be appropriate for a neuro-ophthalmologist.
So would ophthalmology refer to neuro-ophtho?
I do often get referrals from my colleagues in ophthalmology, but I do also get quite a few from primary care physicians.
Okay, interesting. Let's talk about the residency path to become a neuro-ophthalmologist. How do you get there?
So you can get there in one of two ways, either through a neurology residency or an ophthalmology residency, because it is a non-surgical subspecialty. That is why it is an option through neurology. So you do the typical either neurology or ophthalmology residency, and then that's followed by a 1-year fellowship in the Neuro-Ophthalmology.
Okay, and it's non-surgical fellowship.
Correct.
Okay, just learning, treating, diagnosing. The joke in neurology is always about finding the lesion and knowing the location, right? Localizing the lesion.
Oh yes.
But then not being able to do anything about it. Is there the same running joke in neuro-ophtho?
For a lot of things, there is, but there are some things that we are able to treat and to cure. One of which is benign paroxysmal positional vertigo. Actually, probably one of the only things that we're actually able to fully cure.
Yeah.
But that is true. It is kind of the diagnose and unfortunately adios.
Yeah, diagnose and adios. I like that. And don't forget to pay your bill on the way out. So let's get back to describing a typical week for you. So as a neurologist by residency training, neuro-ophthalmologist by fellowship training, how much of your job is neuro-ophtho versus neurology?
Currently, I do about 80% general neurology and 20% neuro-ophthalmology. There are neuro-ophthalmologists that do full-time neuro-ophthalmology. It generally consists of essentially a full day of clinic. There are consults that we are responsible for in the hospital, depending on the setting. In academic centers, you do have more kind of inpatient consultations.
Are you, as a neuro-ophthalmologist, are you more prone to full-time neuro-ophthalmology in an academic setting versus a community setting like you're in?
I think the nature of the subspecialty really lends itself better to an academic setting, just because there are a lot of ancillary testing that we have available. But working in the community setting, I don't feel like I've been limited in that respect.
What drew you to community versus academics?
The research or the absence of research, rather.
The absence, yeah. So you didn't like the need to constantly be churning out research,
correct? And the politics of climbing the academic ladder, I just would rather not deal with.
Yeah, makes sense. It's a very common reason. So talk about that typical week then. You come into work on a Monday. What are you doing day in and day out?
And so it's for neuro-ophthalmology, it's essentially almost 100% clinic. There are the inpatient consultations that I mentioned, but in my practice, they're handled by the general ophthalmologist that is on call, and then if they have any issues, they'll refer them to me to be seen in clinic.
What does call look like for a neuro-ophthalmologist?
For at least judging based on the call I took in my fellowship, I served as on phone call. So the residents would call me whenever an issue came in and that they had any questions about.
Yeah. What is a typical neuro-ophthalmology emergency where you'd get a phone call or maybe you would even have to go in?
The biggest one I would say is a condition called temporal arteritis, where you have inflammation in the blood vessels at the side of the head, which can either present with irreversible vision loss or lead to impending vision loss. And that's one instance where we need to act quickly to get the appropriate treatment started.
Elevated SED rate?
Elevated SED rate.
Boom.
Yep.
I still got my medicine down. All right. So call not terrible. Not a lot of emergencies where you'd have to go in.
I think I went in maybe twice during my fellowship in the middle of the night. But
yeah. Okay.
Very manageable.
Do you feel like you have good work-life balance?
I do. More so better now that I'm out of training than when I was in training, of course, because you're kind of available 24/7.
Yeah.
But I always felt I was able to do things around the city and not have to worry.
Not fellowship. So fellowship is 1 year. How big or small are the typical neuro-ophtho programs?
So it's generally only one fellow a year at any institution. There are some that have two. I think only one program has 3 fellows a year. So it's a very small community.
Q3, man, that's nice. So if you go to a fellowship and you're the only one, you really are like 24/7 for that year.
Correct. Yeah.
How do you handle that?
It gets better over the course of the year. The middle and end of the year, the residents are well seasoned, and so they, at least at my program, tended to wait until the morning to call rather than 2:00 in the morning. And so that was fine. I did.
How competitive is neuro-ophtho?
It varies by the year. My year, I think we had, or at least most of the spots fill. The following year, or this year, I know there are a lot of open spots that are available. So it fluctuates, but it's certainly not difficult to land a spot.
For a med student who is interested in neuro-ophtho, what should he or she be doing to be competitive if it is one of those competitive years?
I think making it to our national conference, which is called NANOS, the North American Neuro-Ophthalmology Society.
Just a cool name.
It is. It's because it's such a small community that everybody knows each other, and so getting your face out and meeting the other neuro-ophthalmologists out there, I think, is really the best way to get ingrained into the field.
All networking.
It is.
Such a huge believer in networking. You need to go out there and meet people and be a good person for them to want to help you. For an osteopathic student listening to this, do you see any negative bias in the neuro-ophtho world towards DOs?
I don't know. There are actually a lot of the leaders in Nanos did come from osteopathic medical schools.
Nice. All right. That's good to hear. So once you're finished with your 1 year fellowship training, what opportunities are there to further subspecialize for somebody that wants that extra punishment?
There are other kind of related fellowships. I know there's a group in Johns Hopkins that does a Neuro-Ophthalmology fellowship where they focus more on dizziness. That has its own punishment. And then a lot of the other groups kind of have their own niche as well. Some of the neuro-ophthalmologists specialize in the pupil, for example. Others in eye movement abnormalities and eye movement recordings. And then others still for more vision loss disorders.
It doesn't make sense to me for a neuro-ophthalmologist, as we were kind of discussing the difference between ophthalmology and neuro-ophtho. The description was for neuro-ophtho, it's a lot of outside of the eye pathology. But for a neuro-ophthalmologist to specialize in the pupil, what about the pupil is interesting for a neuro-ophthalmologist? Other than it's just a really cool thing.
I think I'd have to ask the people in that group.
Yeah.
I don't know why, for whatever reason, they're known as the pupil people.
The pupil people. I like it. All right. For the primary care physician that's listening to this, if you were to go and give them a presentation today about how to treat patients with some sort of ophthalmologic condition, and train them on how to better be aware of certain conditions that you treat day in and day out, what would you want them to know?
As I guess with any specialty, really examining people with your own eyes is not, no pun intended, it is important. And so while there are things that can wait in neuro-ophthalmology, I think also not being shy about reaching out to a neuro-ophthalmologist whenever you're concerned about any issues. If it's not appropriate for neuro-ophthalmology, we'll direct you otherwise. But I'm always willing and open to answering any questions.
It sounds like a very similar to general neurology, where I know when Allison was on a while ago talking about general neurology, the need for primary care to know a good neuro exam. So it sounds like very similar. You need to know how to look at an eye, look at a retina, and kind of get some sort of differential going. Any specific resources that you think are top-notch for primary care to look into to learn eye exams?
Yep. So there is a online database called Novel. I think it stands for the Neuro-Ophthalmology Visual Education Library.
Neuro-Opthos with the acronyms.
Yeah, we have all the good acronyms. Where they have examples of all the things that we read about in our textbooks going through medical school, and so they always have pretty good examples.
Okay, good. What specialties do you work the closest with?
I would say neurosurgery, because brain tumors often can impact vision. My colleagues in neurology as well, that of course is a great overlap. And then we do see a lot of dizzy patients in neuro-ophthalmology, and so the ear, nose, and throat doctors as well.
Are there any special opportunities outside of clinical medicine that you see neuro-ophthalmologists taking advantage of?
I know of a few that went into industry. There's a couple of major clinical trials that are ongoing, looking into treatments for some of these neuro-ophthalmic diseases, but it's mostly clinical practice as the kind of end game.
What do you know now that you wish you knew before starting your fellowship training?
I don't know that I've really learned anything yet, being so early on in my professional career. But there is an end game at least, and there were times during my fellowship where I would have liked to call it quits, but glad I didn't at this point.
What do you like the most about being a neuro-ophthalmologist?
I like the variety. I mentioned earlier that there's a little bit of different areas of neurology in neuro-ophthalmology, and so every day there's something new to learn. And my patients continually teach me something new.
What do you like the least?
The charting.
Everybody.
Yeah.
Everybody has the charting and billing. But although because the company you work for, you don't have to worry about billing.
Correct. Yeah.
That's nice. Do you see any major changes coming to the field of neuro-ophtho for somebody that may be on this path as a med student or maybe even as a pre-med that they should be aware of?
I think neuro-ophthalmology is still a rather new subspecialty. And so I feel like there are kind of two peaks in terms of the neuro-ophthalmologists that are practicing out there. Kind of the first generation that are starting to get to retirement now, and then this newer generation now that's coming through. And so I think there will be a lot of turnover in terms of the field, and we'll be losing a lot of the mentors that we had. But I don't think that'll really change the practice of neuro-ophthalmology.
If you had to do it all over again, would you still be a neuro-ophthalmologist?
I would, yes.
Any last words of wisdom for the med student out there, pre-med, or maybe even a neurology resident who's listening to this, thinking about neuro-ophtho?
I would say come to Neuro-Ophthalmology Clinic and check it out. I had no thought about it before the rotation, and here I am now.
All right, there you have it. Hopefully you learned something. I know I did. I didn't know that neuro-ophthalmology, the majority of neuro-ophthalmologists out there, were diagnostic physicians. They don't operate. You could have fooled me. I think of ophthalmology, I think of a surgical subspecialty, but when you add that neuro on the front of it, then you lose the surgical part of it. You don't get that training. So hopefully you learned something about community-based neuro-ophthalmology. Can you do me a favor? I would love for you, if you're a medical student right now, just like Anthony Tran is at the University of Colorado, he's a first-year medical student here, he shared this podcast, the Specialty Stories, in his Facebook group for his class. If you have a Facebook group for your class, or you have some sort of email listserv or email group, whatever it is, I would love for you to say, hey, fellow classmates, check out this podcast that Dr. Ryan Gray does, Specialty Stories. Listen to it, enjoy it while you're exercising, taking a break from all of your other studying. So I would love for you to do that. I hope you have a great week. I'm always looking for more guests, interesting guests, interesting specialties. So if you know anybody, if you have a family member who's a physician who should be on this podcast, email me, ryan@medicalschoolhq.net, and we'll make it happen. Have a great week. We'll see you next time here on Specialty Stories.